and I just had jaw surgery. I had MMA July 1st, so we're coming up on 6 months.
Wow.
And I had a severely, I looked decent from the front, but from the profile view, I had no face. I had a beach ball with a nose is what, I don't remember who coined that term, but I didn't realize how retrognathic I was. My airway, before I started fiddling with my face over multiple treatments, I think you did some similarly, had a path similar. I was very retreated. My airway on the CBCT was about 2 millimeters anterior posterior. I did various other treatments that brought my maxilla forward, but I just got fed up and I was tired, and I'm like, I'm just getting MMA.
Yeah. My audience is extremely interested in jaw surgery, and that's a trend that we've seen. I would say over the past 2 years is it went tooth-borne, then it went MARPI, and now people are like, screw it. Let's just talk jaw surgery. Let's just talk full facial reconstruction with predictability, with precision, and in a timely manner. Now, you being so meticulous about apparently every last detail of everything in this space, tell me, how did you go about planning your own jaw surgery? Because it's like a super high stakes thing to decide, okay, what are these movements that we're going to do, and what effect are these movements going to have on how I ultimately look? Should we go, an extra 2 millimeters or 2 millimeters back? How about the rotation? Genio, no genio? How did you go about making these huge decisions about how your face would look for the rest of your life?
It's so interesting. I gave David almost all of the liberty to plan it. However, we did have a meeting a few weeks prior, and I was able to tweak things. So I was able to say, we were able to plan things, and it's hard to know really what your skeletally what it's going to look like. But I'm sure at some point the software is going to be able to, generate what your face will eventually look like. But
yeah, some people have, like Dr. Bell uses a thing called 3DMD that directly meshes with the Materialize software that like Dr. Alfie and other custom plate users who use Materialize, which is the plate maker. Essentially, you plug in the 3D surgical plan into the 3DMD, which has taken a high def, like essentially imaging of your face and digitized it with like 12 super like high quality cameras. You have to have a setup in the office to do the 3D MD scan, but then it meshes the jaw surgery plan with the soft tissue, and then it can predict the change with each surgical movement. But it's not perfect. But it's something.
It's a something. Is that that's the surgeon in California?
Yes, Newport Beach, California.
Newport Beach. Yep. No, I truly just trusted David, and it's hard because I have this very strong COIS background. I mean, my educational beginnings, very fortunately, were with the COIS Center. So I knew how much tooth display I wanted, or gum display, where my canines should be. So I'm telling David all of this, and he's like, "Well, I'll do whatever you want." And I'm like, "Well, you know best. I don't know." I can say I want this much tooth display, but he's like, I think you should do this way. And I'm like, okay. Mm-hmm. So I truly gave him a lot of trust and faith.
Did you have him tweak things any farther forward or backward at least? Were you like, no, I think I want to really go for it? Or were you like, that looks a little aggressive. I think I'd rather scale things back, or not even? Not
even. The only thing I think we were tweaking was a little bit of the roll. Yeah. I mean, not much, honestly. I think I made like 5 changes with him, and not much.
Yeah, I would. You don't have to. I'm not even asking, putting you on the spot, but I would love to see a before image. And then, because I think you look great right now, and your tooth show certainly is perfect. I mean, I haven't seen your side profile, but that looks really good.
The only thing that was really hard for me was I never had a chin. So all I could think of look when I see my face for 5 months was like, all I saw was chin.
Did you do the Genio?
I did a Genio. Yep. So I had Lefort, BSSO, bilateral split, and then a Genio.
One piece Lefort?
One piece Lefort.
And do you know how far forward you came at the tip of the chin?
Pagonion came forward 15 millimeters.
Good Lord.
And then a point, because it was of the counterclockwise rotation, it didn't come as, I believe it was supposed to be like, if you just translated without the rotation, it would have been about 1 centimeter. But when you do the counterclockwise rotation, a point moves from this to this, right? Because you're rotating. So I had a 16-degree counterclockwise rotation.
16 degree?
Yep.
Dude.
I didn't know I was that. I had no idea. I don't know.
What did it feel like when you woke up and had this whole new face?
So the first thing I remember was like my tongue felt like it was in this massive new room. I was just like, it was the weirdest. Like I don't have a ton of scalloping, but I didn't realize how confined and constricted. I could see it on my CBCT, but that was really the first thing was like, can I even touch my teeth with my tongue? It was so weird. And then I did not realize how numb my face was going to be. And it was intentional. Dr. Alfie injected an 96-hour lasting bupivacaine anesthetic, which he did it for the pain management, but I did not realize the profoundness of being that numb. So finally, after 96 hours, when it wore off, I was numb, obviously, from the surgery, but it was like, whoa, it was a bit of misery for 3 days, 4 days. But
when the pain finally hit?
No, just the dysfunction. So I have a good colleague here in Seattle, Rebecca Clark. I think I was mentioning her to you. She's a brilliant hygienist turned myofunctional therapist who then had jaw surgery here in Seattle with a surgeon who I won't mention, but then decided she needs to help formulate a better before and after system for patients to rehabilitate. So she's created an orofacial recovery program.
Wow.
And it's so cool. She's teaching others. I took the course, but it was just to learn what she's doing. So she added lymphatic drainage. She became a massage therapist. So you can actually, like, my max opening before surgery was only 37. And she was like, girl, we should have gotten you to the 44 before we could have done that. I was like, really? So if you
max opening, meaning how much you can open your mouth?
So we should be at 44-ish or more. I'm still not. I'm at 32 or 3, but I had no TMJ symptoms. Like my only symptom, if you will, would have been I couldn't open as wide as I should have. I had no popping, no clicking, no limitations other than that. And it didn't debilitate or it didn't inhibit anything. So I didn't think anything of it. But Rebecca's point, or Becca, she goes by Becca, really is get the function as optimized as possible. And then the recovery is much better. Like I would have healed at least functionally faster